What if one simple breakfast habit could completely distort your blood test results, and your doctor wouldn't even know? Most people don't realize it, but the way you prepare for a blood test, even something as small as a morning walk or what you drank the night before, can quietly sabotage your health results. For seniors, especially those over 60, blood work isn't just routine. It's your health dashboard. It tells your doctor how your organs, hormones, heart, and immune system are functioning. But here's the uncomfortable truth. Many seniors are unknowingly walking into labs primed for false readings. Why? Because no one teaches you the science behind how to prepare for a blood test. And that's exactly what this video is here to correct. The consequences? Misdiagnosed thyroid issues, incorrect cholesterol panels, blood sugar misreadings that lead to unnecessary medications, or worse, missed warnings. And it's not your fault. Even many well-meaning doctors forget to explain these nuances. But the science does explain them. Your blood, like your brain, operates in a dynamic system, one influenced by circadian rhythms, hydration, nervous system arousal, even the timing of your last movement. Modern neuroscience and functional medicine are giving us deeper tools to understand how these variables shape the results we depend on. And the best part? You can fix most of it with a few smart behavioral tweaks, starting today. In this video, you'll learn the top 10 mistakes seniors make before blood tests, and more importantly, what to do instead. Backed by science. Explained simply. Actionable from tomorrow morning. I'll show you how one shift in your morning routine can improve hormone accuracy, why you should never drive yourself to early tests, and the surprising link between anxiety and iron levels. Let's decode the data together, so your labs finally reflect your true health, not a fluke. You've probably heard that the best time for a blood test is early morning, and that's true, but only partly. What most people don't know is this. Your body is biologically wired to have a cortisol surge first thing after waking. It's called the cortisol awakening response, CAR. For seniors, this can be even more pronounced due to age-related shifts in adrenal sensitivity. Here's what the research shows. Cortisol, your primary stress hormone, naturally rises within the first 30 to 45 minutes after waking. This helps you feel alert, mobilizes energy, and even boosts blood pressure slightly, a natural wake-up call from your endocrine system. Now here's where it gets tricky. If you wake up, rush to the lab, skip food, deal with traffic, and then get poked with a needle, you're stacking stress on top of a natural cortisol peak. What's happening in your brain and body is this. Your hypothalamus is triggering a sympathetic nervous system response. Your adrenals react by flooding your bloodstream with even more cortisol. Why does this matter? Because cortisol influences blood glucose, thyroid hormone conversion, and even testosterone and estrogen levels. That means your labs could show higher fasting glucose, suppressed T3, active thyroid hormone, or skewed sex hormone panels, simply because your nervous system is on high alert. Let's make this real. Imagine two seniors, both 65. One wakes up gently, sits by the window, takes 5 minutes for deep breathing, sips a glass of water, and calmly heads to the lab. The other wakes up late, rushes through traffic, and walks into the lab already agitated. Their lab results? Drastically different. Not because one is less healthy, but because one's body was primed for stress, and the lab captured that in real time. So what's the fix? A simple tool to apply is what I call a pre-lab parasympathetic window. Here's the protocol, backed by behavioral neuroscience. 1. Wake up 90 minutes before your blood test. Let your body naturally stabilize post-awakening. 2. Spend 5 minutes in quiet breathing. Inhale for 4, exhale for 6. This activates your vagus nerve and shifts your body out of sympathetic mode. 3. Avoid screens and stressful conversations before the lab. Even reading the news can trigger a subconscious stress response. 4. Hydrate with 12 to 16 ounces of water, preferably room temperature. We'll explain why hydration matters more in a later section, but it also supports cortisol metabolism. By the time you walk into the lab, your cortisol curve is tapering, your nervous system is calm, and your internal metrics, from blood sugar to thyroid function, are more reflective of your true baseline. Have you ever felt like your test results didn't match how you actually feel day to day? This may be why. It's not just about what you test. It's about the state you're in when you test. And here's a powerful note. One study published in Psychoneuroendocrinology showed that people who practiced slow breathing before blood draws had lower cortisol and more stable glucose levels than those who didn't. It's not just calming, it's clinically significant. So next time you schedule a test, remember, the numbers on that lab slip aren't just data. They're a reflection of your brain-body state. And that's something you have more control over than you think. Now, we'll talk about the second biggest mistake, the innocent breakfast habit that could completely invalidate your fasting labs. And if this insight is helping you see your health through a new lens, consider subscribing. We go deep into science like this every week. Let's say your doctor told you, come fasting. You skip breakfast, show up to the lab, but you still had a splash of milk in your tea, or half a banana because you were lightheaded, or just black coffee, which you've always been told is fine. But here's what most people don't realize. Even a small deviation from a true fast can drastically change your blood results. And in seniors, where hormones and metabolism shift more subtly with age, this distortion can lead to false diagnoses or missed ones. Let's break down what fasting actually means. According to the American College of Cardiology and Mayo Clinic guidelines, a true fast is 8 to 12 hours of no food, no caloric drinks, no supplements, and ideally no caffeine. Water only. That's because your digestive system, liver, and pancreas remain in a rested state, allowing for a stable reading of blood glucose, insulin, cholesterol, triglycerides, and even iron levels. Now here's the twist. Black coffee, even with no cream or sugar, still activates your nervous system, elevates cortisol, and stimulates lipolysis, fat breakdown. This can falsely elevate your triglycerides or blood sugar, especially in people over 60 whose metabolic flexibility is reduced. One study published in the American Journal of Clinical Nutrition found that drinking black coffee an hour before a glucose tolerance test increased blood sugar responses by up to 50%. That's not a small blip. It's enough to misclassify someone as pre-diabetic. And fruit? Even half a banana or a few grapes. Fructose is rapidly absorbed by the liver and changes ALT and AST readings, liver enzymes, not to mention glucose and triglyceride levels. Now, let's imagine you've been doing fasting labs for years, but always have your coffee. Your doctor sees slightly elevated glucose or triglycerides and recommends a statin or metformin. But the numbers weren't real. They were influenced by your pre-lab ritual. So what should you do instead? Here's a simple behavioral protocol, science-backed and easy to follow. 1. Stop eating and drinking anything caloric by 8 p.m. the night before your test. That includes milk, alcohol, juices, or late-night snacks. 2. Skip your morning coffee or tea entirely. Yes, even black. Wait until after your blood draw. 3. Only sip plain water in the morning, ideally room temperature. 4. If you take morning medications, talk to your doctor about which are okay before fasting labs and which might need to wait until after. Many blood pressure or thyroid meds can be taken with water, but others should be delayed. Have you ever thought, it's just a small cup, that can't make a difference? Now you know, it can. And this is especially true for seniors. As we age, our insulin sensitivity declines, and our hormonal response to food becomes more sensitive. What used to be a harmless snack or sip can now throw off your entire lab panel. So remember, the cleaner the fast, the clearer the data. And your health deserves that clarity. By the way, if these insights are opening your eyes, or if you just learned something your doctor never told you, consider hitting that like button and subscribing. This channel is all about giving you real science you can use. Now, we're going to tackle a surprising one. Why light morning exercise, even a short walk, might sabotage your labs. And yes, this includes walking your dog before heading to the lab. You woke up, felt stiff, and thought, let me just take a quick walk or do some light stretching before my blood test. Nothing intense, just to feel better. Seems harmless, right? But what if I told you that even mild activity, like a 10-minute walk, yoga, or climbing stairs, can quietly distort multiple lab values, from kidney function to muscle enzymes, especially in older adults? Let's unpack what's happening in your body when you move, and why timing matters more than you think. When you exercise, even lightly, your muscles release creatine kinase, CK, and lactate dehydrogenase, LDH, enzymes involved in energy metabolism. These are natural byproducts of movement. But here's the catch. Elevated CK and LDH levels are often interpreted as signs of muscle damage, inflammation, or even heart stress. Now imagine this. Your doctor sees those elevated numbers and thinks there's a possible liver issue, kidney stress, or cardiac concern. Suddenly, you're sent for follow-ups, all because of that quick stretch you did to feel limber. But it doesn't stop there. Exercise also increases potassium levels in your blood because muscles release potassium during contraction. Combine that with mild dehydration, which we'll discuss soon, and you could see abnormal potassium readings that make your doctor question your kidney function or electrolyte balance. A 2014 study in clinical biochemistry found that even moderate aerobic activity 1 to 2 hours before blood draw significantly elevated CK, AST, and ALT levels, especially in older adults. These changes persisted up to 24 hours in some participants, even without symptoms. That means your gentle walk could mimic liver inflammation, muscle injury, or early-stage kidney issues. But none of it would be real. Here's another angle most people overlook. Cortisol and adrenaline both spike slightly with movement. This can influence glucose, insulin, and inflammatory markers like CRP, which are key indicators in aging-related conditions like type 2 diabetes and cardiovascular disease. So what's the fix? A simple protocol to apply is this. 1. Avoid all intentional movement for at least 90 minutes before your blood test. That includes walking, yoga, stretching, house chores, even light gardening. 2. If your lab appointment is early, sit or lie down after waking. You want to arrive with your muscles and nervous system at rest. 3. Avoid using stairs before your test. Take the elevator. Sounds minor, but multiple muscle groups fired during stair climbing, which can increase CK and lactic acid levels. 4. If you must move, keep it minimal and gentle, and tell your doctor exactly what activity you did. Have you ever gotten lab results that seemed off, but your doctor brushed it off or said to retest later? This might have been why. There's also a psychological layer here. Many seniors are in the habit of getting the body moving first thing in the morning, a great habit in general. But before a lab test, that helpful behavior becomes a misleading one. It's not about cutting out movement. It's about strategic stillness when data matters most. One final note. If your lab results have ever made you feel like something was wrong, when you felt completely fine, that gap may not be your body. It may be your pre-lab behavior. Now, we're going deeper into one of the most overlooked issues in senior labs, medications. Which ones to pause, which ones to take, and the timing that can make or break the truth of your test results. Here's a scenario I've seen too many times. A senior walks into the lab, takes all their morning pills with a glass of water, thinking they're doing everything right. A few days later, the results come in. Their sodium looks low. Their thyroid markers are off. Their liver enzymes are elevated. The doctor orders more tests, maybe adjusts the meds, maybe even raises concern, but the lab results weren't telling the whole truth. Here's what most seniors aren't told. Some medications, even when taken as prescribed, can skew your lab results significantly. And it's not just what you take, it's when you take it relative to the blood draw. Let's look at a few common examples. Take diuretics, often prescribed for high blood pressure or fluid retention. These medications can lower sodium and potassium levels in the bloodstream. But if taken just hours before the lab, they can show artificially low electrolytes, prompting doctors to adjust a dosage that might actually be fine. Or consider statins, taken for cholesterol. If taken the night before or the morning of a test, they can mildly elevate liver enzymes, triggering unnecessary concern about liver health. In some cases, doctors have paused or switched statins based on what was actually just a timing issue. Then there are thyroid medications, like levothyroxine. If you take it before your test, especially without fasting, it can spike your T3 and T4 levels, creating the illusion that your dose is too high. But it's not. The hormone just hasn't stabilized yet in your bloodstream. Here's the neuroscience behind it. Your body is in a state of metabolic transition immediately after taking any medication. Your digestive, endocrine, and circulatory systems are actively processing the compound, and that changes the chemistry of your blood. So what's the protocol? Here's what the research and clinical experience suggest. 1. Know which meds are essential to take before testing. These usually include heart medications like beta blockers or certain blood pressure meds. But always check with your doctor. 2. Delay non-essential medications until after your blood draw. This includes thyroid pills, statins, vitamins, and supplements, unless specifically told otherwise. 3. Bring a complete list of medications and supplements to your test, including doses and timing. Many labs now include a notes section for exactly this reason. Your doctor needs to know the context to interpret your numbers correctly. 4. Avoid over-the-counter medications for 24 to 48 hours before labs, especially NSAIDs, like ibuprofen, which can impact kidney function and liver enzyme readings. Here's a real-world example. One study published in the Journal of Clinical Pharmacology found that more than 30% of abnormal lab results in seniors were linked not to disease, but to medication timing, interactions, or transient drug effects. 30%. You might be thinking, but my doctor never told me to skip meds before labs. That's common. The system assumes you either follow a set protocol or that your provider will interpret the data in context. But as you've probably experienced, that context often gets lost. And when that happens, you're left confused, maybe even anxious, reacting to numbers that don't reflect your actual health. So here's your empowerment tool. Take control of the variables. Clarify, confirm, and communicate. Ask your doctor this exact question before your next test. Which medications should I take before this blood test? And which should I delay? By the way, if you're starting to see how these small tweaks can radically improve your lab accuracy, consider subscribing. Every week, we dig deeper into the science behind aging smarter, so you're not just surviving, but thriving. Now, we'll cover a hidden disruptor that most people overlook. If you've ever walked into a lab feeling just a bit thirsty, dry lips, maybe skipped your usual morning water, you probably didn't think much of it. But that seemingly minor detail could quietly throw off multiple test results, especially if you're over 60. Here's why. Your blood is about 90% water. When you're dehydrated, even slightly, your blood becomes more concentrated. That affects the concentration of sodium, potassium, BUN, blood urea nitrogen, creatinine, hematocrit, and more. And in seniors, this effect is even more pronounced. Why? As we age, our sense of thirst declines, kidney function naturally changes, and we lose water more easily through respiration and skin. That means you could be dehydrated without any strong physical cue and still show up to your test thinking you're fine. Let's break this down with a quick example. Imagine you didn't drink much water the day before your test. You fasted overnight, skipped your morning hydration, and walked into the lab dry. Your kidneys are trying to compensate, so your BUN and creatinine appear elevated, mimicking signs of impaired kidney function. Your hematocrit, the percentage of red blood cells in your blood, might also rise due to the lack of plasma volume. That could raise flags for dehydration, anemia compensation, or even cardiovascular issues. All of this from simply not drinking enough water. A study published in Annals of Clinical Biochemistry found that mild dehydration in adults led to statistically significant increases in BUN, hematocrit, and albumin levels, just from 12 hours of water restriction. Now here's the mistake. Most seniors think fasting means no food and no drink. But unless your doctor has specifically instructed no water, which is rare, staying hydrated is not just allowed, it's essential. So here's the protocol. 1. The night before your test, drink 1 to 2 glasses of water before bed, ideally with electrolytes if you've been sweating, sick, or using diuretics. 2. In the morning, sip 12 to 16 ounces of water slowly over 30 minutes. Room temperature is best. Cold water can stimulate mild stress responses in some people, which could influence your readings. 3. Stop drinking 30 to 45 minutes before the blood draw to avoid dilution or discomfort during the test. 4. Avoid caffeine before your test, not just because it breaks a fast, but also because it's a diuretic, which can further dehydrate you. And if you're thinking, I don't feel dehydrated, remember, by the time you feel thirsty, you're already 1 to 2% dehydrated, enough to impact your labs. There's a psychological benefit here too. When you hydrate properly, you feel clearer, calmer, and more in control walking into the lab. That mindset shift alone can lower cortisol, reduce anxiety, and keep your nervous system in a stable zone, all of which helps improve lab accuracy across the board. Hydration isn't just about how you feel. It's about the quality of the data your doctor is using to evaluate your health. And that makes it one of the most underappreciated tools in your blood test toolkit. Now, we're going to tackle one final and surprisingly emotional factor: how your mental state, especially anxiety, can alter your test results in measurable ways. And remember, if this content is helping you advocate for your own health, share this video with someone who needs it. Empowerment spreads when we talk about what matters. You sit in the waiting room, fingers tapping your leg. Maybe it's the thought of needles, or the fear of what the results might show, or just the rush of getting there on time. Either way, your chest is a little tighter, your breath a little shallower. This isn't just emotional. This changes your blood. Science has shown again and again, your emotional state, especially anxiety, alters key biomarkers. This is especially true for seniors, whose nervous systems can become more reactive with age. Let's break down what's happening. When you're anxious, your brain activates the hypothalamic pituitary adrenal axis, HPA axis. That's the core of your stress response. The result? Increased release of cortisol, adrenaline, and noradrenaline. These chemicals do more than just make your heart race. They change your white blood cell count, elevate glucose, suppress immune markers, and can even alter thyroid hormones. In fact, a study published in the Journal of Clinical Endocrinology and Metabolism found that acute psychological stress, like anticipatory anxiety before a medical procedure, caused significant spikes in cortisol and glucose levels within just 15 minutes. So what might that look like on your lab report? Elevated fasting glucose, even if you're not diabetic. High white blood cell count, mimicking infection or inflammation. Mildly elevated cortisol that could mask adrenal fatigue or HPA dysfunction. Lower T3 or TSH that gives a false read on thyroid function. Your doctor might interpret these changes as disease, imbalance, or early dysfunction, when really, you were just nervous. And here's the kicker. Many seniors carry chronic low-level anxiety around health. Maybe it's from past health scares, or a long medical history, or just a natural sensitivity to medical environments. That chronic stress often goes unspoken, but it's always measurable. So how do you correct for this? You can't eliminate all anxiety, but you can train your body to enter a parasympathetic state before your test. Here's a simple protocol. 1. Arrive 15 to 20 minutes early. Don't rush into the lab in a panic. Let your nervous system decompress. 2. Practice a slow breathing technique in the waiting room. Inhale for 4 seconds, hold for 4, exhale for 6. Repeat for 3 to 5 minutes. This activates the vagus nerve, calming the body and lowering cortisol. 3. Visualize a peaceful place or replay a calming memory. Studies show visualization can rapidly shift brainwave patterns from beta, stress, to alpha, calm. 4. Avoid triggering conversations or media. This is not the time to scroll news headlines or argue about politics in the car. 5. Tell your technician if you're feeling anxious. Believe it or not, they often adjust technique and pacing when they know someone is sensitive. Here's something powerful. In a study from psychosomatic medicine, participants who used slow breathing and visualization before a blood draw showed 30% lower cortisol and significantly more stable glucose and white cell readings compared to controls. That means just a few minutes of intentional calm can dramatically clean up your data. Have you ever had labs come back with slightly abnormal findings and wondered why? Your state of mind at the time may be the missing link. So let's make something clear. Blood tests don't just measure your biology, they measure your state. And the good news is, you can shift your state on purpose with a few simple tools. Now, we'll recap all 6 insights and give you one simple, powerful challenge to apply before your next lab test. So let's recap. You've just learned that your blood test results, the data your doctor uses to guide your health, are not just numbers. They're reflections of your state, your hormones, your habits, your hydration, even your emotions. And the truth is, most seniors have never been taught how to prepare for a lab properly. But now you know. Let's revisit the 6 most common mistakes and the science-backed solutions. 1. Waking up and rushing in. Your cortisol peaks naturally after waking. Add stress, and you amplify the spike. The fix? A calm morning routine, deep breathing, and at least 90 minutes before testing. 2. Just a sip of coffee or food. Black coffee isn't neutral. It raises cortisol and blood sugar. A banana, even half, changes your liver enzymes. The fix? A true fast, nothing but water for 8 to 12 hours. 3. Exercise before the lab. Movement boosts CK, potassium, and adrenaline, and may mimic muscle or organ distress. The fix? Strategic stillness. No workouts, no walks, no stairs. 4. Taking medications at the wrong time. Some meds skew labs, not because they're bad, but because of their timing. The fix? Ask your doctor what to pause, what to take, and when. 6. Dehydration distorting the data. Even mild dehydration thickens the blood and alters readings. The fix? Hydrate the day before and the morning of, 12 to 16 ounces of water, sipped slowly. 7. Letting anxiety hijack your results. Fear, tension, even minor nerves can raise glucose and suppress thyroid hormones. The fix? Breathing techniques, visualization, and arriving early to calm your system. Now, imagine you apply just 3 of these strategies before your next test. Your numbers might shift, not because you got healthier overnight, but because your labs finally reflect your real, rested, hydrated, stable body. And that's the key message today. The more accurately your lab reflects your baseline, the more power you have to act on it. You don't want decisions made on distorted data. You want clarity, because clarity creates confidence, and confidence changes everything. So here's your challenge. Choose one protocol from this video. Maybe it's fasting properly. Maybe it's deep breathing before your next draw. Try it before your next blood test. Then compare your results. See what shifts. See what your doctor says. That's how you start taking ownership, not just of your labs, but of your longevity. And remember, your health doesn't just depend on medications or surgeries. It depends on informed behaviors, like the ones you now have in your toolkit. If this episode helped you feel smarter, calmer, and more equipped, please hit that like button. If you want more science-backed content on aging well, brain health, sleep, strength, and smart longevity, hit subscribe. And if you know someone who always gets weird lab results, share this with them. Because you deserve health data you can trust. And that starts not in the lab, but in the habits leading up to it. Until next time, stay curious, stay empowered, and take care of that brilliant body and brain of yours.